We're so glad you're here because we have a really fun topic today. And when I say fun,
it's interesting.
It's super interesting and really informative. And the cool thing about most of our lives are that we're giving you information, and you might notice that we have a bend in our opinion, but the cool thing is it's all the information, and then you get to make the choice.
Yeah, you gotta do, and then take what
do
we
your
have
own research
and do your own research. Talk to your own care provider, see what.
Yes.
Like gather everything, and then trust your gut. Use your intuition, and make the decision that's right for you and your family. So
yes, so we're gonna give it to you tonight, and we're talking about delayed cord clamping.
Are you familiar with that? That's something that has become much more regular, much more actually like procedural in the hospital with care providers in the last, I'd say probably 5 to 7 years.
Yeah, and maybe even more. It kind of was becoming a thing when I had my twins.
So that was 10 years.
So 10 years. So it's really, really interesting. If you've been wondering about this subject or
have never heard about it,
give us a hand raise so that we know.
Or if you have heard about it but don't know necessarily why, well, you're going to give you all the good,
give you all the
details, the pros, the cons, kind of what's out there.
And maybe if you've had an experience with delayed cord clamping, let us know in the comments.
Okay.
So good. So we have a few of you. Perfect.
Some people who know what we're talking about. Okay.
Yay.
So we'll start with the beginning.
What is delayed cord clamping?
Okay, so essentially what it is when the baby comes out, it's the common practice, especially in hospitals, is to immediately clamp and cut the cord.
Like the minute the baby is born.
It's like baby's out, and now we're immediately clamping, cutting, removing, and then handing baby, or like taking baby over to the warmer, or like if there's any sort of complications or anything like that, then they have a mobile baby.
So that practice actually mostly started once hospitals, births in hospitals became a thing. Before then, it was not necessarily, it was an immediate clamp. So
yeah, yes.
So it's kind of become more of a medicalized procedure. But here's the coolest part. Your baby is born with only 60 to 70% of its blood volume within its body. And the reason is...
Well, so the cool thing is your baby has to go through this really tight space. Plus, they're growing in a tight space. Yeah. So you'll see actually studies that say that there's the same amount of volume when a baby's born as when they're in utero. And that's accurate because there's less blood volume in the baby when they're in utero as when they're without. So what happens is only 60 to 70% of their blood volumes in their body when they are born. And so once they're born, it's really cool reflex. When the air hits their cheek and the pressure is off of their chest, they have the reflex to take that breath. Because before that, they didn't need to. Nope. That cord was breathing for them. Essentially the gills, right? Mm-hmm. So now that they're breathing, then a message is actually relayed to from the baby to the placenta that says, okay, baby's out, now we're going to pump this blood into the baby.
So now it's not a transfer or whatever. It's just like, okay, now all this blood goes into baby.
And so once the baby has all the blood it needs, then the message is relayed back to the placenta, okay, baby's good. And then the placenta, which we talked about last week a bunch about for placenta encapsulation, detaches itself from the uterine wall, moves forward, and then is able to be birthed.
Yeah. It does it. Your body just does that.
Isn't that so cool?
It's so cool. It's so cool that really when we give our bodies a chance to just do what they're made to do, they do all the right things.
So
just like what she said, the baby breathes, the cord, the placenta releases all its nutrients and blood into the baby. Once it's done, it detaches, and then that's when the placenta can be birthed. And the cool thing is if anything is if there's any complications, there's a care provider there to help. But really, have you ever?
Usually they're concerned about like respiratory and things like that, but they still can. In fact, actually, and again, do your research, and decide and talk to your care provider about it. But think about it. If
studies so that is part of it. That can be an issue that happens.
And so our bodies are super smart. They're really, really great too. And their number one goal is to survive, right? So if this is happening where the lungs aren't able to take in breath the way that they're supposed to, that little baby's body's like, okay, we've got to get more blood here. We got to go stat. So it starts pulling blood from other areas of the body. And they did some research and studies on some rats and found that rats that had their cords immediately clamped, they ended up having lesions on their brains, like they had been suffocated, mostly because A, there wasn't enough oxygen, and then B, it was pulling blood, the oxygenated blood, from the brain to the lungs to help support the lungs.
That is so cool.
Isn't that crazy?
I didn't know about that study.
Yeah.
That's amazing. So we can only imagine that can be part of a baby's respiratory life, is just being able to get that blood from the umbilical cord. And it doesn't take like days or it's 2 to 5 minutes.
That it's pulsating.
It's
now,
true.
I've read a whole bunch of stories, and this is probably the crunchier side of the argument that says that the cord shouldn't be clamped or cut before the delivery of the placenta. So take that as you will. Like, maybe that's something that you choose to look into. Maybe it's something that you are okay with, just the 2 to 5 minutes. Maybe you find some sort of compromise with your care provider. I don't know. For me, I actually, like, all my pictures with my baby, I've got like a bowl with the placenta next
with
to
the
it.
baby attached.
Just because it's like I'm just holding the baby and I'm living that golden hour, and I can't be bothered by other instruments. And so I've definitely way like taken that to a next level.
But she just keeps the placenta attached to her baby for
probably an hour.
It was probably an hour. So again, if that isn't conducive for you, I have some really good research about the blood transfusion, if you will. That's not the right word, but delayed cord clamping accounts for 40% increase in blood volume. So that baby, if you delay that for 2 to 5 minutes, 40% blood volume, actually, wait, keep with me. 45% increase in hematocrit, that's the iron level in the blood. 50% increase in total red blood cell volume, and 50% of, so did you get all that? 40% blood volume, increase in blood volume, 45% increase in hematocrit, 50% increase in total red blood cell count, and 50% of that happens within the first minute of delaying your cord. So if you know you can't get a half hour with your placenta, if you can get 1 minute,
it's way better than just the immediate.
It's way, way, way better. And then the other 50% comes within that 2 to 5 minutes after, when that cord is still pulsing. So, and the placenta hasn't necessarily been delivered yet. So, really, if this is important to you, your minimum is 2 minutes. If you can get 2 minutes.
Okay, and actually, we had a really good question. Ashley DM'd us before. She lives on the East Coast, and she probably isn't here live because it's super late. So she wanted to ask beforehand, but she asked about cord blood banking and delayed cord clamping. Like, what can you do? So in a bunch of research that I did, I found, again, do your own research, but assess for yourself. I found that you up to 2 minutes, they can still extract there blood to do the cord blood banking. But after 2 minutes, there was like a 46% decrease of participants that were able to get enough blood for the cord blood banking. So you could do both. Maybe you cap it at a minute and then clamp it.
If you would like to do both, if you'd like to do most effectively. Otherwise, you might not get everything you need. But the tissue, they can harvest the tissue
at any time. So that's not a problem.
That's something to just pay attention to and look into if you are wanting to do both. We have another really, really great question about what are the reasons a provider may not want to do delayed cord clamping. Krista makes a good point. It is becoming a more common practice. Absolutely. We would say definitely in the last 5 years, it's become
more of a
way
in
more.
fact, you'll even see it in hospitals that they'll have it like a lot of times they'll have like a board that's like that'll even give you options like, are you doing delayed cord clamping, Y or N, like yes or no. And so the thing about it, I would say, is it really just comes down to your care provider as far as like if you have an old school guy and that this is the way that we've done it, and
it's second nature.
They
don't
it's
even
just
think about
like,
it.
This is the
here's
next
the
thing
baby.
to do.
Here's the thing. These are the procedures we do. It's a routine, and they're not really thinking about it. So a lot of times you have to have that conversation in a OB appointment before. It needs to be in your birth plan. It needs to be remembered.
You need to be really aware in the moment. I mean, it is super exciting. Like that baby's there and out, and sometimes that it's just like we're going through the motions, and this is the next thing we do. So I've had it where like the husband was like, whoa, we're gonna wait for a few minutes, and like literally put his hand out to stop the scissors from going. So there's that aspect, and then I also have had mostly it would just come down to your care provider. I would say like 100%.
But I feel like it was such a thing a long time ago. So the more the doctors practice, which is so comforting to have a doctor that has been practicing for a long time, the more likely it's just going to be a routine for them. So your birth partner or anyone there needs to just be aware that you're not going to remind them.
Important. Yeah. You're in the moment.
You're in the moment.
You just pushed the baby out. Like and labored. So like that's
and I think somebody even mentioned that. Like I really wanted to and I always forgot because you just did work.
In the moment.
So really this is important. It's important to communicate it several times to your care provider. And I would even say the nurses that are if you give them a birth plan, you could, make sure that's said. And if you don't give them a birth plan, you could just be like, hey, I really don't want to cord clamp right away. I want to wait 5 minutes. And will you help that happen for me? So that is a good way to go as far as that goes. Do you want to should we talk about milking the cord?
Yes. Okay, so there's another, so again, it kind of comes down to your care provider. There's a couple of objections that we have found with some that we've heard. Like I've had a couple clients that have had this situation. So two things. Number one is cord milking. So that is where the doctor was like, oh yeah, well I can just milk the cord for you, and then it goes a lot faster. So what they would do is just take the cord and then take 2 fingers and then like strip the cord into the baby.
Yeah, just like push the blood from the placenta into the baby.
And saying like, oh, that's a lot faster. And
then you don't have to wait so long.
Yeah, is essentially so long, like 2 to 5
it's like
minutes.
5 minutes. We have our own personal opinions. Sorry to side note this for just a second. Here's the thing. A lot of times care providers, they have 4 to 12 other people having babies and they want to be there to show up for them. And there's an aftercare process. And when you are making them wait 5 more minutes to do their aftercare process, sometimes that can be like, I got 14 people to take care of. So then they'll say things like, let's milk the cord. And if we could just give your sweet self one piece of advice, it would be to say, it's okay. It's just 5 minutes.
Just stand up for yourself. Like, it's 5 minutes. And so they can, like, they really can. It's just like sometimes they're just
in a routine.
They're in their job.
Yeah, they're doing their job.
Which is good, but at the same time, like, you need to make sure that you're getting
this is your experience.
The experience that you are wanting and needing.
Yeah.
So
back to the milking.
So the milking, in the research that we have done, that is not the same as letting the cord pulsate and let the placenta pump the cord or the blood in. So what ends up happening is that let's see if I'm getting the right like statistics, is not the same as delayed cord clamping. Stripping the cord leaves babies with too high of hematocrit.
Hematocrit.
Oh my gosh. I want to put the syllables on the wrong emphasis.
The hematocrit. So interestingly, all that iron that's in the placenta, that as it slowly moves through, it's being utilized and put where it needs to go. And when you milk it, it pushes it in. It pushes all that iron in and leaves the baby's blood iron levels too high because it wasn't able to be absorbed and to be placed where it needs to go.
So, so that can actually become a problem, and it can make the blood thick. And that's when you read studies of like, oh, delayed cord clamping can make the one of the con is making the blood thick. It's actually the cord milking.
It's the milking
that is doing that.
Yes. So that is. I know we've had a couple of questions. Sorry. Right here.
I've heard the placenta can time out after due date while baby is still unborn. Would that be a reason not to delay cord clamping? So time out, like stop producing or
like
stop...
get old. I've heard that too. Like people say that. Is that what you mean? What like your placenta is aging and before you've even had your baby?
Which it does happen, but it's pretty rare. I would say it's pretty rare, and I still think it probably is a good idea to delay the cord clamping.
If your cord is pulsing at all and it's red at all, there's blood and there's flow. If it's white and limp, then you're fine. Then you're fine. But if there is, and I wish we should show a picture. We'll show a picture at some point where you'll see it like. It's like purple and it's alive. Yeah. And then within 5 to 10 minutes, it looks like a noodle. It's just like, eh.
Yeah, it's really limp and it starts to go thin and become.
So even if your placenta has timed out, I like that verbiage actually. If there's any movement in blood, if there's any sort of blood or pulsing, you're fine. You can delay.
Yes, get old, she says. Okay. What about a C-section? Is that an option? Yes, actually, it's still an option. Another wonderful thing is that there a lot of hospitals are starting to do mom baby friendly cesarean sections, and
they're awesome.
They are, so typically what that entails is like the curtain is lowered so you can see more of what's going on. You're not entirely strapped to the table. You have the opportunity of skin to skin in the OR. Yeah. So there's that, and then also the delayed cord clamping as well.
And that's a really, I would say in a C-section situation, it's a beautiful time, to do a delay because you want that baby on your chest as long as possible anyway. If there's not another
be on like your abdomen, a little
on your abdomen, but on your skin. You want that baby on your skin and so if you can delay a little bit without there being like a medical issue, that would be awesome. Super awesome.
Yes.
Veronica, thank you for all the random hearts.
We love hearts. That's so funny.
So thank you.
I love it.
Okay, and then we answered that question.
So another really cool thing about delaying the cord clamping is the iron. So iron, I want to make sure I get all of the numbers correctly.
Where is it?
We had some technical difficulties. Is it on the front page?
You look at that one.
We had a printer that kaputted out after our first page of notes. So
I don't see it.
I don't see it either. Okay, iron levels. So one of the biggest issues with babies in the first year of their life, 6 to 12 months of their life, is low iron, and that's why a lot of pediatricians recommend rice and cereal
like
things
iron fortified.
that are fortified with iron, or supplementing with formula that are fortified in iron, because babies are low in iron. But guess what? They're finding that babies that have had delayed cord clamping have adequate iron storage.
And so they don't need those.
It sounded weird out of my mouth.
Adequate iron in their like blood iron levels. So those like iron fortified foods that the first year, it's typical for a infant to have weird iron levels. So they're finding, because they got all the blood and all the volume and all the red blood cells.
And it was because of years and years of practice of the immediate cord clamping, and they were finding that these babies were depleted in iron. But guess what? They actually aren't. It's just that we were interfering with the process. And so now that they're letting this happen, that the baby is now receiving all of the blood that it was supposed to have, it is actually sustaining them through the first year of life. And so they aren't anemic.
So they're not
yep,
anemic.
Exactly.
So
Isn't that so fascinating?
Yeah, it's super fascinating. And so so we obviously think delayed cord clamping is super
We
cool.
are biased. We are definitely
I never
biased.
did any of it. I never had. All my kids were immediately like clamped and cut within minutes. I just didn't know. I didn't know. And again, it was the process of life and we know better, so we're doing better. Yeah, if you know better, you can do better. Or if you know, you can research and make your own. Yeah. And now you have an educated decision to make.
Yeah, now you know that's an option.
Yeah.
So, which is really cool. So,
and you might decide that doesn't matter to me, but something else matters to me more.
Or yeah,
that's cool too.
Well, okay, this was the second thing that I was going to say about care providers and one of the objections. I was in a legit delivery where the doctor said, because she wanted immediate skin to skin, and then she also wanted delayed cord clamping, and her provider said, I'm sorry, I cannot do both. You have to choose one or the other, because if you want delayed cord clamping, I have to hold the baby below the placenta so that the blood will flow into the baby, down into the baby. Otherwise, if I put the baby on you, the blood will just flow back into the placenta. And it was an interesting conversation, because I mean, sweet lady, she was in labor. Like, she's pushing at this point. Or like crowning and unmedicated. So, anyway, so she came to a quick compromise that she was like, fine, hold the baby below and then hand him to me after a few minutes. But here's the deal. It's not gravitational that like how do you get blood to your brain? Like, it's not gonna.
It's capillaries and veins and
arteries
and pumping.
Like,
it's a legit pump, so it will do it.
Yeah. So there is a little bit of backflow, because there's two arteries, one that goes to the baby and from the baby. And the cool thing about the placenta and the cord is that you've got two separate people's blood that actually never intermixes.
It's just
inside,
flowing.
like, you've got a baby inside you, and you actually never get their blood inside of you. Isn't that
so cool?
So amazing. So the plumbing of the cord and the placenta is super cool. But so there's a little bit of a backflow from the baby, but after 45 seconds of the baby's birth, like, it doesn't matter where that baby is, how high or low or wherever, there will not be any backflow from the baby. So
yes,
just know that if that is something that comes up with your care provider, there is a argument for that.
You can refer them to some studies.
Yes,
that have been done. So Veronica had a question about my kids. Did my kids have low iron blood levels? And absolutely every single one of them were anemic. And not that this has anything to do with it, but they had bilirubin issues. Like, there's other
actually
issues.
that is the main con for delayed cord clamping.
Yeah.
Is the bilirubin levels. So the jaundice tends to be a little higher in babies that have had delayed cord clamping. However, it's very normal for all newborns to have high levels of bilirubin, just because they have an immature liver. Like, it's just trying to figure out how to
within days.
Yes, and so it usually peaks at day three.
Isn't it 3?
Day 3.
I think it's 3.
So it usually starts at 24 hours after, and you'll start seeing yellow in the eyes and like the nose.
When you press,
and as you press on the skin, you'll see kind of how much saturation in the body.
It's way cool. If you really press, it'll be like yellow, and then white. And then cool.
It peaks at like day 3 or 4, I feel like, maybe 5. But after that, it starts to recede and come back. So,
yes. And then one other thing that I wanted to point out, in the cases of not to delay cord clamping, are more obvious, like if the cord is wrapped around the neck, do not delay a cord clamp. Or if there is...
Well, because the baby can't.
If it's
pulled and they're not getting oxygen, their heart rates are dropping and things like that.
And so you're smart enough, you understand that. So, and then the other one would be that there is an emergency that the baby needs to be taken away for. But I would ask lots of questions around that too. So, Brittany had a question if we're hiding in a closet. We are in our shipping room.
We're in our shipping room. These are our gowns.
So that's
super fun. There was also another question about, so she has, so I have negative blood and have an RH shot with, would that affect the ability to cord clamp? So Alina's a negative.
Yeah. Hey, RH negatives, right?
Yeah, the potato, or the peanut butter shot.
The peanut butter.
In the bum.
Yes. It's super, no, you can delay cord clamp.
It shouldn't be an issue at all.
It won't be an issue. It's just the only thing that's different for us is we get shots. Before, like at your 7 week, and then you'll get a shot right after you have your baby. So it's pretty awesome. One other one. Is there any, is there info as to why the correlation was made? I can't imagine I was a delayed cord baby but had bilirubin as a baby. I don't know. That's a really good question. We should do some more research and tell you about bilirubin. Yeah. It seems super weird to me. Every one of my kids had severe bilirubin issues. Like I had to have them in a suitcase for like a week of light.
I will say that there is I think it comes down to hospital policy, honestly. Oh. So you might want to like do research beforehand as to like what levels are normal, what levels are typical, what levels are excessive, and then assess, because I feel like there is kind of just like across the board nowadays that it's like, oh, like the levels are higher than normal, which to be fair, you don't want your child to have jaundice and or like complications with jaundice. And so putting them in lights is definitely a better option than the alternative. Yeah. However, you can make it like mother friendly. I actually just read an article of this mom. It was so fantastic. The nurse came in and was like in the middle of the night and was like, the baby's levels are high. We got to put the baby under lights. Like, and kind of like stirred all this commotion up, right? Instead of explaining gently, okay, this is what's going on. These are the levels. We have some concerns about this. I think we need some to give this baby some light therapy. And the nurse the next day actually like explained everything gently to her, and then said, like, how about you put your baby on you, and we put the lights on the baby and you, and like made that a little bit more of a
baby friendly,
mom friendly experience. And she said it made a huge difference to her. So if you're feeling like really frustrated that your baby is separated from you and under these lights and it feels like so excessive, then look into other options and see if you can compromise with like, okay, I'm fine, let's shift the lights. I want the lights on me, and I'm gonna hold this baby, because again, that skin to skin is actually really, really helpful to regulate baby's levels as well.
So this is super cool. You guys, let's do a live on bilirubin.
Yeah, we got a lot of questions.
Yeah,
this is good.
There's lots of questions. So we want to give you all the parts of what that looks like.
No, Veronica, you are absolutely right. It's not old school at all. She said the funny thing is
near a window.
Put her near a window, and
a lot of times that will clear it up.
Yep.
And again, because it peaks at like day 3, and then it usually will come down.
And do you want to know what else does? Breast milk and pooping.
Yes, and pooping is a big one.
Pooping is huge. Yeah. So if the more you feed them, the more they eliminate. Yep. The more you put them in the sunshine. Go hang out near a window or outside. Obviously in increments of time, so it's not like they're getting sunburned or exposed to the sun at excessive amounts. But yes, it can really help with just eliminating. That's how you're going to get the bilirubin to move on.
It's just an immature liver not being able to process some of what the baby, all the new chemicals and hormones and all the things that have happened. But we'll do a live about that. Yeah. And kind of, so what are your options? We'll look into some studies and see if there's some good options that we can.
Okay, yeah. And Krista wants to know, just to be clear, bilirubin and jaundice are the same thing, right? Essentially.
Jaundice is
what happens when you have
of elevated bilirubin.
Are we sisters?
I don't know.
Or twins.
Just kidding.
We're
reading each other's mind.
Bilirubin, yep.
is what your liver makes jaundice is the condition. Yeah, you guys
know.
You guys are the smartest.
I don't have any kids, and I'm not expecting, but this is so fascinating. I had no idea delayed cord clamping was even a thing. Hannah, thanks for being here. I'm impressed you're here.
I know. So now you know before you even need to know. I love that.
Yeah. Jaundice is mostly common in babies born earlier, but my daughter was a week and a half overdue and still had it. Yeah, so honestly, all newborns have some level of jaundice. Like literally, like they're just immature livers. So there's going to be some level of jaundice, but premature babies, yes, it's actually a very, very common, like, big problem with premature babies.
So... good things.
And Emily said she's late to the game. Well, we were talking about delayed cord clamping, but it kind of morphed into jaundice. So
there's lots in this one. There's a few things. And
we had a low battery
notice. Anyway, so that is it. We have a giveaway this week.
Yes, we do. If you have any questions and we didn't address them, please DM us or throw it in right now if you have it. If you are watching this after it being live, please DM us. Like let us know if you have any questions.
We love it.
And interact with us that way too. We love getting your DMs and all of that.
And just clearing up any questions. It's super fun for us.
And letting us know if you had any experience with it. Yes. And if you knew about it and wanted to know that was something that you have always wanted.
And so this has nothing to do with delayed cord clamping, but it has to do with having babies.
It does.
And
which honestly, Kay, do you want to know what we wanted to get? Which maybe we still at some point. But because we're like, what has to do with delayed cord clamping, like the umbilical cord? So I really wanted to get nail clippers, like for your baby.
Oh yeah, they were out of them.
They were totally out.
That's so dumb. I know, so cute, huh? So instead, this week's giveaway winner, which remember, you need to comment on our live. So if you're watching this after the fact, all we want is a comment from you.
DM or something.
Yeah, DM, whatever. And be subscribed to our emails, which come out every Thursday. And it's a recap of
what we talk about here. And then what's great about that is, yes, you attended the live, but now you have it in your inbox. And so it's something that you can refer back to. We call it our cram sessions.
It's our cram session, and even this video is embedded in a link so that if you need to go back and refer to something we said specifically on this video, you can do that. So we are excited. So if you want to be part of this giveaway,
are you guys excited? It's right here.
We're really building this up.
Okay. Oh, it's kind of...
Everybody needs a letterboard.
Isn't that kind of fun? And it even says, like, Oliver.
Then you can put their date, and then you can take all those cute pictures in the incubator. You know how they do that?
Cute.
And they're
with
so cute.
Their little birth date.
Their birthday. And then you can use it for all the cute things that you want to use it for.
Yeah.
And maybe
you don't have to
we're late. Yeah. Maybe we're late to the letterboard game.
Who doesn't have a letterboard? I want to know. Maybe
I do not have a letterboard.
I don't have a letterboard either. Maybe that's why we were like, oh, this is a great idea. But maybe everybody has one. But if you don't have one, give us a comment. Let us know if you don't have one.
Or you can gift it to a friend or whatever.
That's true. Isn't this a cute... This would be a cute baby gift.
It is cute. Or you can hang it somewhere.
Yeah,
or use
you could always use more than one letterboard.
Yeah, you can, for sure.
I just decided.
It's true. Anyway, this is the giveaway, and we're super excited. And, we're just
we'll
happy
announce
you're
the giveaway winner in the email on Thursday, and probably just on our social media on Friday. So
a lot of you don't have one yet. We're not late.
We're not late.
Good. Okay, awesome. We love you guys. Thanks for being here.
Oh.